Do you struggle with shoulder complaints? And by shoulder complaints, it can be rotator cuff tears, bursitis, tendinitis, impingement syndrome, or just generalized shoulder discomfort that's never been formally diagnosed from a health professional. If you do, and you're an office worker, there's every chance that something that you're doing at work is the cause of this complaint. Now, the shoulder complaint that you're experiencing, you may not notice it while you're sitting at your desk. You might notice it when you play tennis on the weekends. You might notice it when you go to push up at the gym. You might notice it when you go and lift your child out of a cot. Shoulder complaints that occur outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor, static postures. And where do we do most of those? At work, of course. It's really important to consider the ergonomic, the behavioural, and the postural considerations that you do every single workday that can be contributing to the shoulder complaint. Let's have a little bit more of a chat about the anatomy of your shoulder and how it's designed to work, and see if we can offer some suggestions as to why you're suffering from the shoulder complaint from an ergonomic and postural perspective. Let's talk about the shoulder and how it's designed to work, especially when you sit in an office all day. There's a couple of things that you need to think about in terms of the shoulder and where you end up with vulnerable to injury and issues. Essentially, the shoulder is a ball and socket joint. It is the most mobile joint in our body, and as a result, it is also the most unstable joint in our body. And when we sit at a desk for 40 hours a week, the shoulder literally just wants to hang by your side. This is the most passive, stable position for the shoulder to be in at any time. When your arm is in this position, your rotator cuff muscles are engaged. These muscles are awesome. They're energy efficient, they can work all day, but they're not super powerful, but they don't need to be when your shoulder is in this position. And so your rotator cuff muscles basically connect your shoulder to your torso and provide a little bit of more stability and help through that joint. Where you run into trouble in terms of shoulder complaints is when your arm leaves your side. You can feel, if you do this now, you can feel as soon as your arm leaves your side, to be able to maintain this position, you need to recruit muscles. And the muscles that you recruit to maintain these positions are your sprint muscles, your pecs, your deltoids, your trapezius muscles. As soon as your arm leaves your side, and the further from your side that your arm goes, your arms become significantly heavier relative to gravity. And as your arm comes out like so, gravity wants to pull it down. And to stop that, what happens is that your body has to recruit sprint muscles to do this job. These three muscles are your sprinters of the shoulder. They're strong, they're powerful, they consume heaps of energy, but they're designed to be used intermittently. Reach for something, come back to center. Write something forward, come back to center. So those muscles are designed to be used quickly, on, off, on, off. Where you run into trouble as an office worker is if you chicken wing your elbow or if you reach for your mouse. As your arm leaves your side, you put huge amounts of pressure on those muscles to maintain this position. And they can do it for a very short period of time. But what they tend to do is they get fatigued and they get tired and they get overused and they get burnt out. And this is why your arm positioning is really important when you sit at your desk in terms of protecting your shoulder. As soon as your elbow leaves your side, what invariably you're doing is recruiting your sprint muscles to do an ultramarathon. And this in terms of bursitis, supraspinatus tendinitis, those are the sorts of injuries that will result from excessively having your arm out to the side. The other element in terms of shoulder complaints for the office worker is what you have to understand is that your shoulder is not a load-bearing joint. Your shoulder is designed to hang passively by your side. If you're a worker who loves to lean on a desk or lean on an armrest, what you're doing is you're basically getting your poor shoulder joint and compressing it together. If you do struggle with shoulder capsular issues, leaning on your elbows or on your hands is one of the worst things that you can do to your shoulder joint. Your shoulder joint's not designed to have this much compressive loading going through it. And so it will not only irritate the joint surfaces of the shoulder joint, but again, you will recruit those sprint muscles to try and stabilize the shoulder joint. And again, if you lean on your elbow for any excessive periods of time, what you will end up with is a shoulder complaint. When you sit at your desk, your arms should just literally hang passively by your side. You should have a slight flexion through your elbow, and your keyboard and mouse should be in this sort of parameter. If you can maintain this over the course of a workday, your shoulder complaints will likely disappear. The first ergonomic consideration in terms of shoulder complaints is when the mouse is positioned too far away from us. Reaching for the mouse like this puts a huge amount of pressure through that shoulder joint. It's really important that when we're thinking about the mouse position, in that it's positioned 5 centimeters in from the lip of the desk, and that your arm is held in a completely passive position with our elbow simply resting by our side. Similarly, the keyboard position is really important in terms of shoulder complaints. As you can see, reaching for the keyboard is not great for your shoulders. Please review the keyboard position and make sure it's 5 centimeters in from the lip of your desk. Having your chair too far away is a definite ergonomic consideration in terms of shoulder complaints. As you can see from this video here, I'm reaching for the keyboard and I'm reaching for the mouse. Both of these things are not great for my shoulder because I'm going to have to maintain that position with my sprint muscles over the course of the day. So just ensure that your chair is close enough into your desk so that your elbows are by your side and your keyboard and your mouse are just in from the lip of the desk. The chair height is really important in terms of shoulder biomechanics. As you can see, if my chair is too low, what happens is my elbows sit below the height of the desk. The problem with this is anytime I want to use the keyboard or the mouse, I either have to hitch my shoulders or chicken wing my elbows to be able to use them properly. So when you're sitting at your desk, please review your chair height and make sure that your elbows clear the height of the desk, because in this position it means that your shoulders are in a complete relaxed position and there's no load going through them at all. The last ergonomic consideration when talking about shoulder problems are armrests on office chairs. The problem with most armrests on your office chair is that they're really poorly designed. They're either too big or they're not adjustable. Why this is problematic is when you sit at your desk, what you tend to do if you have poor armrests on your office chair is that you adjust the office chair to suit the armrests. This is problematic on a number of fronts. The first option is what happens is often the armrests hit the desk. If that's the case, what tends to happen is you're sitting far too far away from your desk, which inadvertently makes you reach for the keyboard and the mouse because you just can't sit in close enough because the armrests get in the way. So this is the first cause of shoulder problems related to armrests. The second thing that we do is, if this is the case, what we do is we put the chair down lower so that the armrest can slide in underneath the height of the desk and we can sit closer to the desk. The problem is now we're sitting too low relative to the desk height. So what we do is we chicken wing or we hitch our shoulders to now use the keyboard and mouse. My preference is not to have armrests on your chair if that is possible. Try and remove them because they take away a lot of bad temptations and behaviours that we have. Alternatively, review the armrests that you have and make sure that they are height adjustable and they are quite short in terms of their width, and then they should be okay to be used. Leaning on your elbows is the single biggest cause of shoulder complaints from a postural perspective. What you have to understand is that your arms are not load-absorbing joints. They're supposed to just hang passively by our side. So every time you lean on your elbow, you put a huge amount of compressive load through that shoulder joint. What it does is it jams it up. You over-recruit your muscles to try and stabilize that area, and invariably you will end up with capsular damage, rotator cuff tears, or tendinopathies. We've talked about how leaning on our elbows is bad, so you can imagine that sitting in this posture is not great for your shoulders. Often we adopt this posture when we're playing on our mobile phones, but it's really important that when we sit, we don't lean on our elbows. This is particularly bad for our shoulders and in this position for our ribs as well. This masculine posture is a huge cause of shoulder complaints, particularly in men. Have a look at what it does to your poor shoulder joint. You massively internally rotate it. And I don't even want to talk about what's happening with your wrist down there. It's really important that when you are sitting, please do not sit in this position. It is awful for your ribs, your shoulder, and your wrist. We've talked about how the winging posture is terrible for your shoulders in terms of ergonomics and postures. However, sometimes you can have all your ergonomics bang on, but you still have this predisposition to wing your elbows. People who type a lot, often their non-dominant hand when they're typing can wing out to their side. Sometimes when you're typing a lot, you may wing both elbows. It's really important, even when you have your ergonomics perfect, that you pay some consideration to where your elbows are. If they happen to come away from your side, it puts heaps of pressure through your shoulder joints and can lead to pain and discomfort. Another behavioural consideration in terms of shoulder complaints is when we reach for our mouse. What can happen is we can have the chair height correct, we can have the mouse in the correct position, but what happens over the course of the day is that the mouse can creep away from us quite unconsciously. As we've discussed, the further our arm comes away from our body, the more our shoulder has to work to maintain that position relative to gravity. As the mouse has crept away from you at 3 o'clock in the afternoon, if your arm's almost at full stretch, it puts huge amounts of strain and tension through that shoulder joint. The way to get around this is to either use a mouse pad, or what we can suggest is to fence the mouse in. This is a really effective technique whereby you get one heavy folder and put it on the lateral margin of where your mouse should be, and you put another heavy folder to put it on the superior margin, and give yourself about an A5 parameter to work within. What happens is as you get distracted with work, if the mouse starts to creep away from you, what you're going to do is hit one of those heavy folders with your hands. And what this will do is it'll draw your attention to the fact that the arm position has been compromised a little. So fencing the mouse in can be a great strategy to avoid reaching behaviours. The last behavioural consideration that we need to talk about in terms of shoulder complaints is when we hitch our shoulder. Your mouse might be in the right position, your keyboard might be in the right spot, your chair is at the good height. However, often we can just hitch our shoulder. It can be sometimes just a behavioural quirk, or it can sometimes be a sign of anxiety. When you're sitting at your desk, it's really important that your shoulders are very passive. So just wiggle them around and make sure that there's no tone or tension in them while using your keyboard and mouse. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you. Whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is book in for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.